What are the different forms of marginalization and oppression? Have you ever wondered how different forms of marginalization and oppression affect people's lives? These issues are complex and deeply rooted in society. They can lead to trauma and mental health challenges, including post-traumatic stress disorder. Understanding these forms is essential for providing effective trauma-informed care and addressing the needs of marginalized communities. Marginalization refers to the process of pushing individuals or groups to the edge of society. This limits their access to resources, opportunities, and social services. It often stems from systemic inequalities based on race, gender, socioeconomic status, sexual orientation, and other factors. Oppression, on the other hand, involves the use of power to maintain social inequalities. It can manifest in systemic, institutional, or interpersonal ways and is often linked to discrimination, which can cause trauma. One form of marginalization is structural marginalization. This occurs at a macro level, where societal structures, such as laws and policies, limit opportunities for marginalized groups. For example, residential segregation and disparities in education and healthcare access are common issues. Higher incarceration rates among certain groups also illustrate this form of marginalization. Interpersonal marginalization happens during direct interactions. Individuals may be treated unfairly or excluded based on their identity. Microaggressions, which are subtle, often unintentional discriminatory comments or actions, are a common example of this type of marginalization. Institutional marginalization occurs within organizations and institutions. Here, policies or practices may inadvertently or intentionally disadvantage certain groups. This can happen in schools, workplaces, or healthcare settings. Cultural marginalization involves the erasure or suppression of cultural identities and practices. This can lead to feelings of isolation and disconnection from one's community. Economic marginalization refers to economic disparities that limit access to resources and opportunities, often perpetuating cycles of poverty. The impact of marginalization and oppression on trauma recovery is significant. These factors can exacerbate trauma by creating chronic stress and anxiety. For individuals with post-traumatic stress disorder, these challenges can complicate recovery. Marginalized communities often face higher rates of violence and discrimination, increasing their exposure to trauma. Economic and structural barriers may limit access to appropriate mental health services. Additionally, cultural barriers can make trauma recovery strategies less effective if they do not account for cultural differences. To address these issues in trauma recovery, it is essential to use culturally sensitive interventions. Treatments should respect and incorporate the cultural backgrounds of clients. Advocating for policy changes that reduce structural barriers to care is also crucial. Ensuring that mental health services are accessible and affordable for marginalized communities can make a significant difference. By acknowledging and addressing these forms of marginalization and oppression, healthcare providers can better support individuals with post-traumatic stress disorder and other trauma-related conditions. Understanding these complexities is a vital step toward healing and recovery for those affected.